For joining us tonight. For many COVID survivors, symptoms last a lot longer than just a few weeks. I'm Caitlin Alexander.
And I'm Zach Fuller in for Tom Overley. It's called post-COVID syndrome, and these COVID long haulers can report struggling with fatigue, brain fog, and other difficult symptoms for weeks or months. And as our Barrett Leone explains, just like COVID-19 symptoms and severity of post-COVID syndrome can vary, she joins us live in the studio after speaking with experts and people struggling with these challenging side effects. Barrett, what did they say?
Well, Zach, Caitlin, hundreds of COVID long haulers from around the country get treated for those long-lasting symptoms at Mayo Clinic. Experts today are even expressing that in some cases, post-COVID syndrome is becoming a chronic condition.
High fever, shortness of breath, body aches, loss of taste and smell. By now, we all know these are common symptoms of COVID-19. But for many COVID survivors who have had these side effects, they can last much longer than just a couple of weeks.
This condition has become more common and more understood.
Mayo Clinic experts estimate 10 to 30% of COVID infections can result with patients struggling with difficult symptoms for weeks to months after their initial diagnosis.
I do have several patients now who are a year or more out from their infection. And it does look like that long haul COVID could be a new chronic infection for some folks and be a new baseline. Some folks, they can have very minimal symptoms, say some ongoing shortness of breath, while in others, the symptoms may be quite severe. They may have shortness of breath to the point that they need to remain on oxygen for several months after their infection, or not be able to do some of the basic activities of life, like walk across their home to take a shower.
That's what makes COVID so scary, because you don't know who and what affects what everyone's going to experience.
Brianne Bernini was on the mild side.
I was drinking my coffee, and in the middle of it, literally the taste and smell were gone.
Bernini was diagnosed with the virus in late November, just getting parts of her taste and smell back early this year.
I have it somewhat back, but I can't smell certain scents. And some of my favorite smells are completely disgusting to me.
Health experts emphasize the best way to avoid this condition is to not get COVID.
The risk of getting COVID-19 far outweighs any risk that the vaccine could pose.
I would rather have the vaccine and have one day of feeling like crud than go through the whole COVID process again.
Post-COVID syndrome is a condition that health experts continue to research and learn more about as the pandemic progresses. There's even hope with clinical trials that more beneficial treatments will become available. On another note, experts have also noticed post-COVID syndrome start to rise in children. But with children oftentimes not being able to communicate their medical needs, there are difficulties in treatment. Zach.